Thank you so much for finding time, for spending some time with us. We've only got 15 minutes, I know, so if I may, I'll set the ball rolling. I found something that I think will interest you. In the service service improvement module, they have a safety theme where the students are asked to talk about what they think could be done better and safer, and I thought that might be something that you probably want to set the ball rolling with.
Well, thank you. I mean, if I was going to say what I think is fab about the NHS at the moment, I've been doing this job for 5 years, and in that period, the demand for NHS services has grown so much that every day we have 2,000 more emergency admissions and 5,000 more elective pathways completed. And yet, despite that, if you look at safety, all the main safety indicators are going in the right direction. So if you look at hospital-acquired harms like urinary tract infections, VTEs, pressure ulcers and falls, they're down 8%. We're harming about 86,000 fewer people every year proportionately. And if you ask the public what they say about their NHS care, they say that the number of people who say their NHS care is good has gone up by 13%. And I think that is because of amazing work by NHS staff on the front line, because we all know the pressure there. But to be improving the standards of safety despite that pressure is a massive achievement.
It is, and everybody's very proud of that achievement. This morning we were at Sunderland Hospital, where we've seen a really good falls initiative. I think the average number of falls should be 6,000, and they were up at 10 or something. They've got it down to 9, and they're incrementally coming down by introducing new approaches. So we've promised on the Academy that we're going to follow their journey, because we do so often just say this is fabulous, but we don't often say how did you get there. So we're going to follow their journey. Everybody in the audience here has an individual question for you, but they've agreed that we'll make some composite questions. Now look, I know I can't, and there's no point in asking about the budget or any of that, so I'm not going to do that, but it would be right, I think, if you said a few words about funding and, you know, as we roll forward to 2020. I'm not really sure now whether we're talking about the funding cycle to 2020 or to the end of this Parliament at 2023. I mean, give us your view. I mean, I know we've got such a lot of other issues that impact on funding the economy and Brexit and all the rest of it. But I think if you could share your views on that.
Sure. I mean, we need more money in the NHS because we're looking after 500,000 more over 75s than we were just 5 to 7 years ago. And you know, it is, if we want the NHS to be the safest, best healthcare system in the world, then money is part of that picture. It's not the only thing, of course, but it is part of it. And what I would say, though, is that you can't just talk about money without also thinking about workforce issues. So I can secure the money from the Chancellor, and then if I haven't got, you know, the extra doctors, nurses, midwives to spend that money on, then all that happens is that you drive up agency rates, locum rates, and you don't actually end up giving better care to patients. So I think probably the biggest thing I've learned as Health Secretary is that you need to make sure that you have a good supply of new doctors, which is why I'm delighted to be talking to a group of people going into the NHS, because you know, in the end, having enough people to employ matters. So in the last year, we've said we're going to increase the number of medical school places by a quarter and increase the number of nurses we train by a quarter. And that's really just the start of taking a much more strategic approach to workforce planning.
On the question of increments, I read that you were talking about linking increments to productivity and what have you. I mean, the real impediment, it seems, and I was with Andrew the other day about agenda for change, really. The difficulty with agenda for change, although it took over from a very clunky Whitley Council arrangement, the difficulty with agenda for change is it doesn't allow you to target pay rises. So, for example, you just couldn't give band 5 and 6 a pay rise, or mental health nurses, or specific geography. Do you think there's enough flexibility in Agenda for Change, or are we likely to see some changes?
Well, we probably do need some flexibility when it comes to targeting the parts of the NHS that are harder to recruit to. And mental health nursing is an area where we urgently need more help, because we're undergoing a huge expansion of mental health provision. But I wouldn't want to target in another way, because I actually think all NHS staff, whichever part of the NHS they're in, have been working really hard. In fact, I don't think they've ever been working harder. Long parts of the day standing on your feet, no breaks. It's very, very tough. And because of the financial situation that we inherited post the 2008 recession, we have had pay restraint in the NHS now for a very long time. And I recognise that has been very tough for NHS staff. So, I think you can do that for a bit, but you do also have to recognise how tough it is on the front line. And I hope the negotiations I have with the Royal College of Nursing and the other Agenda for Change unions will allow us to have, to get some flexibility from them, so that we can have modern contracts that are fit for purpose of today's NHS, but also allow us to recognise that the 1% pay awards that we've had previously haven't done justice to how hard people are working.
Let's switch now to some more operational managerial type of things. I think to encapsulate what the questions were saying is, on the one hand we've got an NHS in the future expressed in the 5-year forward view, which has a huge fluidity and flexibility about it. We've got, on the other hand, we've got a regulatory framework which still implies a top-down grip to what is going on. It's command and control versus a fluidity. Hierarchies never work, networks always do. And I think the students were interested really in how you see the future of the operation of the NHS, which now, if we go towards accountable care organisations, a greater flexibility on the ground, but still within the framework of a command and control.
Well, it's a really interesting question and a difficult one to give a pithy answer to, but I would say that you want room for both. So if I give you command and control, it seems to me absolutely crazy that one hospital will be paying £1.27 for some surgical gloves, and the hospital next door might be paying 50 pence for exactly the same pair of gloves. And what you want to do in that situation is say, well, look, let's purchase these things as an NHS, the biggest healthcare organisation in the world, and get the world's lowest prices for surgical gloves, syringes, couch rolls, all the things that are the bread and butter of hospitals and surgeries, and get the best prices. On the other hand, when it comes to new organisational forms like accountable care organisations, then I think it's very dangerous to be top down, because the truth is we don't really know the best structures. All over the world, people are reinventing care so that we focus more on prevention and less on cure. But nowhere's really cracked it. You see good examples in Spain, in some parts of America, in some parts of Sweden, but no one's cracked it. So I think we need to retain that flexibility. I think the one thing I would say, just going back to safety, is that we do need to be much better. If we're going to have a bottom-up structure where there's much more flexibility, we've got to be better at spreading best practice. So, if we've got some of the best consultants in the world for breast cancer in the Christie or the Marsden, and you had a relative who had breast cancer, and you lived in, Kings Lynn or Bristol, I think you'd want to know that they were getting, the leading treatment, and that you'd want to be confident that the NHS was spreading the message around our system. And if we're honest, we don't actually do that very well at the moment at all. You could get completely different treatment for something like breast cancer, and it will be pretty random even within the same hospital. So I think that's probably how I would characterise it.
Right, I'm going to switch back, if I may, to staffing, because this is obviously a question that we can't avoid. We've had the changes to the bursary. We're not quite sure what the upshot of that is likely to be yet. We've had the interruption of colleagues coming in from Europe with a huge drop off the cliff really with the number of people coming here with the uncertainty of it all. You've increased the number of places for training, but increasing the training places doesn't mean to say they're going to be filled. I mean, how do you see the future of well, let's just stick with nursing, and by that I mean nursing and not healthcare assistants that on the wards that supplement them. I mean the sort of the hardcore, if I can put it like that, trained nurse, trained midwife, trained professional coming in. I mean, you must have done some numbers. You've just recently, I think, asked for the first time I can remember, a proper workforce plan to figure out what the numbers should be. Give us a few words on your thoughts on that, if you would, please.
Well, bottom line is, if we want our NHS to be the safest and highest quality system in the world, then we're going to need a lot more nurses going forward. I mean, we can use technology much more effectively, we can increase the skill levels of the nurses that we have, but we're still going to need a lot more nurses. And I think the big lesson amid staffs, if you read the Francis report, was that there were wards in that hospital where if you read that report, you just know there weren't enough of them there. And as we know, that wasn't just a problem of mid-staffs, there were pockets of that problem all over the NHS. So, I'll be completely open. I took the decision on bursaries. I didn't want to take it. I resisted it for a long time. But it was the only way that I could afford a 25% increase in the number of nurse training places, because we just have to train more people so that more young people are getting the skills they need to go into nursing. It was very disappointing that I had to do it, but with the resources I had, the only thing I could do. What else can we do? I think every hospital has got some fantastically well qualified band 3s, healthcare assistants who've been working a long time in the hospital, who everyone knows would make an amazing nurse. We make it really hard for them to transition into nursing at the moment because, they might have to cut their pay so that they go to night school, which means they can't do evening shifts. And we need to have a smooth transition on the job between being a healthcare assistant and being a nurse. We are going to be doing that through the nurse apprentice route, which means that as a mature, experienced person, you'll be able to get into nursing without incurring a penny of debt. And I think that would be a fantastic thing. And then the final point you said, Roy, we must do everything we can to reassure our brilliant EU colleagues. We know the NHS would fall over without the fantastic work they do. It's obviously an unsettling period. We've made it very clear that we want to stay, we think we will be able to stay, we're not in any doubt about that, and we want a close friendship with the EU and with Europe post-Brexit. But the more we can say that to those colleagues, the better.
The final question from here, and then a final word over to you, if you will. Really, in general terms, it's about mental health services for children and the gaps in the services and the delays. And we know Claire Murdoch's working on that, and there's a lot more money earmarked for it. But translating that actually into beds on the ground is always much more difficult. So a word about that, and then a final word to the audience, and we'll let you go.
Oh, thank you, Roy. Well, look, mental health is very, very close to Theresa May's heart. She's always championed it. From the moment she walked through the door of Downing Street, she was talking about it. But to deliver this plan, it's a really ambitious plan that Claire Murdoch is heading up. 1 million more people being treated for mental health conditions in our country every year by 2020, 2021. That's a massive expansion. And it relates to what we've just been talking about. We need the bodies to do that. And that's why we've announced an extra 21,000 posts in mental health that we are seeking to fill. It's going to be very challenging to deliver that, but we know we won't reach our objective unless we do that. So I think workforce is the key issue. My final comment to everyone who is giving their life to the NHS, and it's fantastic that you're doing that. I grew up with my dad telling me that one of the best reasons to be British was that in our country, it doesn't matter who you are, rich or poor, young or old, you can always be confident of getting great health care. And that's why I've asked to go back to this job 3 times now, under 2 different prime ministers. Despite all the ups and downs of Westminster, I'm thrilled to be doing the job I'm doing. And when you read the papers, you read about doom and gloom. But we're very honest. We're more honest than any other healthcare system in the world about our problems. And that's because we want to be the best. And when you ask the experts, like the Commonwealth Fund, the independent American think tank, they say we are the best. But we're not resting on our laurels. There's a huge amount of change happening. And it's going to work, and it will happen if we have great people wanting to join the NHS. So thank you for your commitment.
Jeremy, thank you very much. This is our second port of call on Change Week. We're spending the whole week, we're visiting 30 NHS trusts, universities. We're at a GP practice this afternoon, and the inspiration of people with their ideas and wanting to share them is fantastic. I know you get around as much as we do, and there's a huge amount of great stuff going on. Thank you for your time, for fitting us in. We're very grateful to you, Jeremy. Thank you very much. See you soon. Thank you. Bye.
Thank you.